Now we're going to talk about adaptive tissue shortening. We don't re-stretch, we re-lengthen that muscle. But it requires a process. And processes are sometimes kind of hard for we clinicians because we're taught to heal, to do to the patient. And many times, because of the funding of healthcare, we're under time constraints. A surgeon's taught to cut. Therapists in rehab are taught to very quickly get the patient back on their feet and rehabbed in order for them to go home, to go back to their job. But when we come to neuro patients, we have to remember to be patient. And we're going to do whatever it takes to start them on the road to correction and relaxing that neurological tone. Then we have to step back and allow their body to go through its own processes. And that's very hard for we clinicians to do. This is a slide of a muscle spindle. If you could see shortened muscle under a microscope, it would look solid. And you have sarcomere units made up of actin and myosin, which are proteins. And these need to be able to glide effortlessly in these sarcomere units. So what we want to do, we have to provide prolonged low-load passive stretch to realign these actin and myosin proteins to prepare them to be re-lengthened. And we know literature says it takes about 6 weeks of prolonged low-load passive stretch to prepare them to be re-lengthened. So when we think about again, back to when I was a child and I wanted to do the splits, we know, you and I know, if we're going to do that, we don't want to force down into the splits. That would be painful. Well, the same thing with our patients. It's counterproductive to try to stretch them too far too fast. Number one, we tend to kick in that stretch reflex and they end up rebounding back here in more flexion than they were when we started with them. But also, we have to follow that process and think about what's going on in the anatomy and physiology of that muscle with the actin and myosin protein in the sarcomere units. As a registered nurse, I am very holistic. It's easy to see why people that work around patients continually can get tunnel vision, and sometimes we forget just how devastating these lost range of motion contractures, these physical deformities can be. They're also very painful, and we don't always remember that either. If you think about what all occurs to the body and the health of the body because of contractures, it's just amazing. And being holistic, you know, one thing leads to another, leads to another. It's extremely difficult to get enough nutrition and fluids into a patient if their body is all forward or deformed in any way. And you and I know how much water or fluids we should take in every day. And many of us don't, even though we know that. But these patients, there is no way, unless they have some feeding tube or an IV, that you're going to get that much fluids in them. It's a continual battle. But the better alignment their body is in, the easier it is to get fluids and proper nutrition into their system. Without that proper nutrition, you can very easily have cell destruction, tissue destruction, especially if you have pressure areas, which contractures definitely lead to. These deformities can cause pressure areas. It's difficult to keep your patient turned in different spots, sitting in different positions to where they don't have pressure on body prominences, on bony prominences where you don't have a lot of tissue to pad those bones. They're more prone to skin wounds. The old term is bed sores. There's also a term decubitus ulcer. But these are wounds, and you're more prone to them if you don't have adequate nutrition and hydration, enough fluids in your body. once you do have breakdown, then it's much harder to heal that breakdown without proper fluids and nutrition and a certain number of calories per day. It's very hard to have proper hygiene with patients who maybe their knees are so tight together or actually crossing. And the majority of these patients are going to be incontinent of bowel and bladder. That means they don't have active control over these systems. That then, if they have urine on their body, on their skin, for any prolonged length of time at all, or certainly bowel with the bacteria, then they're more prone to skin breakdown in those regions. So you keep going back and forth. If your shoulders are all over and you can't get good lung expansion, you have to breathe in enough air. Your diaphragm is a very important muscle below your lungs, and it comes down and pulls air into your lungs. And you have to have a greater concentration of oxygen molecules in your lungs in order for that to go through the semipermeable membrane at the lung area in order to be picked up by the bloodstream. The blood circulates through the body and picks up carbon dioxide and other garbage, and it's going to dump the carbon dioxide off here at the lungs. But if you have fluid in your lungs, or you can't get good lung expansion because your shoulders are forward and your posture is forward, then you don't have that adequate oxygen carbon dioxide exchange without getting oxygen into the bloodstream to be picked up by the red blood cells. It can't be carried throughout the body, and oxygen is vital to all cells of the body. And we can actually see dementia symptoms if you don't get enough oxygen to the brain. The carbon dioxide, then, you need a certain amount to trigger breathing, but too much is not good. You need to breathe that back out into the atmosphere. If your joints are contracted, it's very hard for the circulation to go through those joints. So to carry the oxygen in the blood to all those cells is a little bit more difficult. If you're really compressed in the chest, your heart may not pump as efficiently, again, pumping blood throughout all the body. If your patient cannot set up on a commode, ladies need to sit in a good 90-degree pelvic tilt, maybe even a little bit more forward to empty their bladder totally. Men really need to stand. If your bladder does not empty totally, then it's not a matter of if it will be infected, it's just a matter of when. It's like a stagnant pond or a puddle will breed mosquitoes. The urine, any residual urine that doesn't get totally emptied out of that bladder, and that's positional, then it will breed bacteria. So we need to be able to, excuse me, get patients up to where they can totally empty their bladder. If they're reclined, they can't do that. Orientation. If we can't have our head up to view our environment and get the stimulation from that environment, and also if we do not get enough oxygen again to the brain, then we will lose orientation. So whether you're forward or whether you recline back in a chair and just looking at the ceiling all day, you can see why it may not take long before you become a bit confused and disoriented. And the most important is dignity and self-esteem. It's hard to feel good about yourself if you see that your body is contracted. We know hands that are closed breed fungus, they breed bacteria, all the things that cause horrible odor. And these people that are alert and oriented know that, and they see their caregivers make faces and maybe even, God forbid, mention the odor to them. But just knowing their body has deformities has to be very devastating for these people. Psychosocial, of course, is very important. We talk a lot about, and we read a lot about, depression in the elderly. Well, I can certainly see why. Many times they've lost their main caregiver or their significant other. If they're in a nursing home, they've given up their home, whether it was a one-room apartment or a beautiful home, it doesn't matter. They've given up their space where they felt comfortable and maybe had lived for years. They've had to abandon things that were very important to them and move into a facility, and many times with a roommate that they may have nothing in common with. They're grieving because they've lost their independence. They've lost probably the person who took care of them to where they could stay at home. Maybe they've had a stroke and they can no longer use one side of their body. For whatever reason, they require more assistance for their activities of daily living. So there's a lot of grieving going on for that. It's kind of like a death. So anything we can do to increase their quality of life and their health is very important. People with contractures typically have decreased interaction with others. Again, they lack that environmental stimuli. If their head is down, they're not viewing in the environment, or they may even choose to stay in their room because they feel their body is unattractive. Again, decreased self-esteem. They have feelings of helplessness. People that have been helpers to others all their life now require help, and they're not able to be of service to others. There can actually be biochemical changes in the body, and these definitely affect our mood and behavior. You can even see negative changes in personality and attitude in these patients. There's a physician, he's a physiatrist, used to be in Louisville, Kentucky. His name is Kenneth Mook. A physiatrist is a physical medicine and rehab physician, also referred to as PM&R docs. I asked him years ago if he would write a couple of sentences for me, just a statement about how he felt best to deal with spasticity. He wrote the following: "I have found that a static, rigid splint is not effective in controlling spasticity because it provides a persistence of a spastic event." Prolonging it, persistence, it draws out the spastic event by not allowing the muscle to shorten. A splint that has static properties with some dynamic give, that's a Kentucky term, during a spastic event allows the muscle to shorten. Thereby, the spastic event regresses, and yet the splint maintains the proper positioning of the joint. Back to the fishing pole analogy. Just like the fishing pole, it allows the muscle to shorten, but with slight tension, and then brings it back to the preset degree. 15-20 minutes of that, you will see muscle relaxation. Early intervention. It is vital that we address these patients as soon as possible. We have much better chance to prevent most, if not all, of their deformities. Thank you.